Good morning, good afternoon, and good evening. Earlier this week, I had the honor of traveling to Bahrain and Kuwait, where WHO has opened our two newest country offices. I also had the opportunity to visit several facilities that have been set up to respond to COVID-19 in both countries, and was very impressed by the innovative and comprehensive approach they used to fight the pandemic.
The Director General of the World Health Organization has raised concern that the world is at risk of losing hard-won gains in fighting COVID-19 as the highly transmissible Delta variant spreads. Tedros Adhanom Ghebreyesus said this while briefing journalists about rising cases of COVID-19.
I went to answer a question I'm often asked: when will the pandemic end? My answer was that the pandemic will end when the world chooses to end it. It is in our hands. We have all the tools we need. We can prevent this disease. We can test for it. And we can treat it. And yet, since our last press conference, cases and deaths from COVID-19 have continued to climb. Almost 4 million cases were reported to WHO last week. And on current trends, we expect the total number of cases to pass 200 million within the next 2 weeks. And we know that is an underestimate. On average, in 5 of WHO's 6 regions, infections have increased by 80%, or nearly doubled over the past 4 weeks. In Africa, deaths have increased by 80% over the same period. Much of this increase is being driven by the highly transmissible Delta variant, which has now been detected in at least 132 countries. WHO has warned that the COVID-19 virus has been changing since it was first reported, and it continues to change. So far, 4 variants of concern have emerged, and there will be more as long as the virus continues to spread.
Tedros blamed the rise of cases on increased social mixing and mobility, the inconsistent use of public health and social measures, and inequitable vaccine use. He said hard-won gains are in jeopardy or being lost, and health systems in many countries are increasingly overwhelmed. The Delta variant that is fast driving the current wave was first detected in India in late 2020, where it is thought to have contributed to the extremely high number of cases during the country's second wave of COVID-19. According to the World Health Organization, the variant has spread to over 100 countries. Kamil Sadiq, reporting for CBA TV.
The increased number of infections is creating a shortage of treatment such as life-saving oxygen. 29 countries have high and rising oxygen needs, and many countries have inadequate supplies of basic equipment to protect frontline health workers. Meanwhile, testing rates in low-income countries are less than 2% of what they are in high-income countries, leaving the world blind to understanding where the disease is and how it's changing.